Welcome to Union Hospital. Founded in Terre, Haute, Indiana in 1892, the original Union Hospital structure was a two-story wood frame home. But from those humble beginnings, Union Hospital has grown to become the Wabash Valley's leading medical center and the largest healthcare provider between Indianapolis and St. Louis. Now with more than 2,400 employees, Union Hospital and its Terre Haute campus have evolved into a major medical center with facilities for physician offices and physical therapy, an ambulatory surgical center, and a comprehensive cancer clinic that includes the Clara Fairbanks Center for Women. Among the inpatient and clinical services housed in the 500,000 square foot east wing of the hospital that was opened in 2010, you'll find the emergency department, Da Vinci Surgical Suite and adult medical and surgical services, the intensive care unit, imaging and respiratory therapy, along with 380 private patient care rooms. Union Hospital's West Wing houses maternity and child services, including the brand new labor and delivery area and neonatal intensive care unit. Cardiovascular services, rehabilitation medicine, and the Wound Healing Center can also be found in the West Wing. Dr. John Bollinger is Union Hospital's Vice President of Medical Affairs and Chief Medical Officer.
Well, I think, one of my dreams is for this to be more of a referral center than we are even at this point. But we have all of the major medical specialties covered in our medical staff. I think some areas that I think we're exceptional at is the area of cardiology, cardiovascular surgery, our orthopedics and joint replacement programs. These are all programs that I think we can really spotlight, and we're second to none as far as what we're able to provide to our community.
Our clinical team at Union includes more than 800 nurses under the direction of Vice President of Patient Care and Chief Nursing Officer Rhonda Smith.
Well, with nursing here at Union Hospital, we have critical care nurses, of course, and then specifically in the critical care, they are divided into a couple teams where they have a cardiovascular team for open heart surgeries, and then they have a neuro team, so any type of neuro cases that would need the critical care requirement. The ER, again, sees all types of patients in the emergency room. We're currently working on specific certifications for each division so that as nurses in the med-surg area or the critical care will also be certified in those areas.
Union Hospital is an accredited chest pain center, a certified primary stroke center, is the home of the Terre Haute area's largest joint replacement center, and the Wabash Valley's only Level 3 newborn intensive care unit. Union Hospital offers accredited cancer care, along with accredited medical and stroke rehabilitation programs. And Union Hospital has been recognized for 5 years running as one of the best places to work in Indiana.
The benefit of doing the residency here is, there's a multitude of benefits. I think a lot of it is the relationships that people develop. We get we're strongly supported by the medical staff. Even though they're non-paid preceptors, they really take residents under the wings. They understand the concept that we're trying to turn out the world's best doctors out of here to be able to go practice a city this size, a large city, or most importantly, a rural location.
So when you use the national system to look at different residency programs, you're able to select by state, region, everything like that. You can go by state, and I wanted to find some place by home. I wanted to do primary care, and I went to medical school with the intention of being a family practitioner, and I decided to look up different programs around my hometown, which is Marion, Illinois. I went all over the Midwest as far as interviewing for a position with a family practice residency program, and I stumbled across Union Hospital here in Terre Haute. I had never heard of this place before. I had never been, pager. And when I came here, I was just entirely impressed.
Union Hospital's strengths are many, among them location.
We're located between St. Louis, Champaign, Indianapolis. We have a good location. We have 5 or 6 smaller hospitals feed into us daily, and we have quite a medical community here now. We have about 300 doctors in the city, and which is almost 3 times as many as when I came here 34 years ago. So Union and Terre Haute have become a moderately large medical world.
Located in Vigo County, approximately 70 miles west of Indianapolis, Terre Haute, Indiana is a city with a population of just under 61,000. However, Union Hospital's service area encompasses Vigo and an additional 8 surrounding counties with a metropolitan area population of just under 250,000. Terre Haute earned its moniker of Crossroads of America decades ago because of the intersection of 2 major roadways in the city. U.S. Highway 40, which runs east-west from Maryland to California, and U.S. Highway 41, which runs north to south from Michigan to Florida. Terre Haute's location is particularly attractive for those who prefer the pace of life in a small city, but seek convenient access to major markets. Chicago, St. Louis, Louisville, Cincinnati, and Indianapolis are all within a drive of 3 hours or less from downtown Terre Haute.
It's easy access for travel. If there's things that aren't available in the small area, it's just so quick and easy for a physician who might say like the symphony or something else. If he doesn't like the symphony here, he can go to an area that's fairly close and enjoy that.
Terre Haute's a nice family town. They've got lots of parks and recreational areas. The shopping is comparative from my perspective. So it's been a really nice transition for me and my husband.
Terre Haute is the home of Indiana State University. With its downtown campus located less than a mile from Union Hospital, Indiana State boasts a student population of nearly 12,000 and offers more than 80 undergraduate and 90 graduate programs, which include the ISU School of Nursing and Scott College of Business. Terre Haute is also the home of Rose-Hulman Institute of Technology, rated as the #1 school in the country, offering a bachelor's or master's degree as its top degree in engineering. U.S. News & World Report has awarded Rose-Hulman the #1 ranking for 14 consecutive years. Just west of the city, you'll find St. Mary of the Woods College, the nation's oldest Catholic women's college. And on the south end of town is Ivy Tech Community College, one of the 14 campus locations found across the state of Indiana.
We have a town that has multiple universities and school systems that have won multiple awards. We have a medical staff that is welcoming of new physicians. It's just, by and large, it's a great place to set up a practice.
The area also boasts a strong public school system, led by Vigo County School Superintendent Danny Tanous.
Well, I think this, without question, we're the #1 school system in the state of Indiana, and I think it's mainly because of the great partnership we have with business and industry. Our parents are very supportive, and we have just a wonderful teaching staff and administrative staff, and all employees work very hard to give every child the opportunity to reach his or her highest goals and potential. And I say we're #1 because our scores are very strong. We do very well in national testing. We do very well in statewide testing. And we also are #1 in many areas in academic competitions.
I raised all 3 of my children here. The schools are above average. They all got in their first college choice, and they all did well. I think this is a good, safe place. It's medicine-wise, it's a good place for a young doctor to come.
And when it comes to a place to call home, you'll be able to do that more affordably in the Terre Haute area than almost anywhere in the United States.
Housing is so much more affordable here in Terre Haute. If you take a look at, let's say, median sales prices of homes. Let's take the north side of Indianapolis. You've got a median sales price there of $197,000 versus the median sales price here in Vigo County, and that's at $85,500. So not only are you getting a good value in your housing investment here, but the other reason that comes to play is, of course, in the state of Indiana, we have a 1% cap on property taxes. So that's based on the value of the home. So not only are you getting a good price in the home, but you're paying half of what you would in taxes in other larger metropolitan areas.
One of my residents, in fact, just moved here at one of my first-year residents from Los Angeles, and he's just amazed at what he can afford here compared to what he left out there in Los Angeles.
Union Hospital in Terre Haute, Indiana. For the medical school student looking for a residency program, this might be the perfect location.
Anytime that you go to a place to interview for a program for residency, there are going to be people that you encounter that are paid to recruit you to the program. It's the people here at Union that did not have to be nice to me, that I was impressed with, the nursing staff, some of the hospital administration that was able to talk to me and actually give me more of a hometown kind of experience. Very polite, smiling, nice people that it just reminded me of my hometown. As far as picking this residency over other places, this residency offers an unopposed residency, so any place that you go to, if they have other professions there that are being trained, family practice kind of gets the short end of the stick. But day one, starting here, I was very surprised. I started on inpatient medicine, and I was running codes and running ventilators and running my IV drips in the ICU the very first day. And I knew that that's what it would be because that's exactly what they told me it would be. And so I was very, very surprised that day one, I was no longer the medical student, and transitioning into the role of doctor happened on day one.
Absolutely, let's jump right in on day one. I mean, it may be a resident on day one puts in a central venous line to a patient, which is actually a fairly big procedure. And now they're obviously not doing that by themselves. They've got help from faculty or an upper level resident or maybe a local surgeon. But it's lots of procedures.
But if you're looking for a prestigious name, I would like you to look again and see what the program is actually offering you and what kind of experience it's offering you. If you look at this program compared to any others, it offers you amazing experience as far as taking care of a wide variety of different patients. And I would urge you to come and check our program out.
To serve our patients with compassionate health care of the highest quality. That's our mission at Union Hospital. Interested in learning more about the Union Hospital Family Medicine Residency Program? Contact Residency Coordinator Vicki Miller at 812-478-4183 or by email at fpvsm@uhhg.org.